or everybody, especially when you're grown up, for holidays like Mother's Day, things can get touchy sometimes with conversations. Here's Laura with how to deal with it.
Knowing where to turn when your loved ones might need some extra help at home can be difficult. Leilani Pelletier from the Alzheimer's Association and Reka Lasachi is here from Caregivers Choice to help us answer some of those difficult questions. What are some signs that it might be time to get some help at home with our loved ones?
Well, many times when parents or your loved ones are starting to be forgetful, they're missing appointments, medical appointments, forgetting their medications or not being able to manage them, and just having difficulties with their personal hygiene. You just notice a lot of these problems coming up.
How would you begin this discussion? Sometimes it can be difficult, I imagine, to talk about this.
Yes, many families have a lot of problems trying to bring that up to, their mom or dad or whoever it is. And it doesn't always go over very well, but sometimes, just asking if we can get some help in there, coming up with different ways to just point out things that might need a little bit more attention.
Leilani, what do you suggest?
I suggest that families, first of all, talk with each other. It can be difficult for someone to recognize or to hear that they need help. So getting them to agree that this is a great idea, I think, is what stops a lot of families. Rick and I were talking, and we both agree that sometimes you just need to make that decision for your loved one and not point out to them where they're having difficulty, but say, Mom, we would love to have someone come in and stop and help with meals. You've been so good to us all these years, and we can't come by as long, as frequently as we'd like to. So we're going to bring our friend, or we're going to bring Janie in to help with meals, and I'll be there the first couple times too. She's a great woman. I'm sure you'll love having her. So kind of painting it not so much as help, but as a gift to the whole family.
Right. I imagine that some family members are in denial. They don't want to accept it, and that sounds like a really easy way to kind of break into getting some extra help.
Yeah, we don't tend to want to be told that we need help. So we have to paint it just a little bit of a different way. It's not lying. It's simply recognizing that there's some things that need to be done, and geez, once in a while we deserve someone to make things easier.
Right, I could use some help at my house as well. What types of ailments or difficulties are good for the at-home care?
Well, basically, if it's things like running errands, if they're not able to drive or to do their grocery shopping, things like that, or even helping to prepare some meals, and things to do around the house, sometimes physically it becomes difficult to do some light cleaning, things like that.
Okay. What's your greatest advice for people caring for someone with Alzheimer's or dementia?
I would say that they really don't need to do this alone. Many times families faced with this feel they can kind of push through everything that they need, and they can. We're amazing at caring for our own family members, but there's so much very simple, non-intrusive information out there that can help you make the decisions that you need to make. I would say call the Alzheimer's Association. We have wonderful, wonderful staff who can answer your questions. Everything's confidential, and everything is there to help you make the best decisions you can. It's a marathon, not a sprint. So arm yourself, fuel yourself as a caregiver, inform yourself, and you'll do a great job.
Great. Thank you so much for joining us. Lots of great information. We appreciate you being here.
Thank you for having us.